Welcome to Wednesday Wellness Debrief, your weekly guide to a healthier, happier you. I'm your host, Brittany, and I'm so glad you're joining me today as we navigate a really important topic, especially this month in May, High Blood Pressure Education Month. Quick disclaimer, our aim with this episode is to offer a supportive space for learning and discussion about wellness. However, it's vital to understand that the information shared is not a substitute for professional medical consultation. We encourage you to use what you learn here as a starting point for conversations with your own medical provider, who can officially diagnose and develop a treatment plan tailored specifically for you. You know, it's easy to dismiss blood pressure. We hear about it, we might get it checked at your regular doctor's appointment, but do we truly understand what it means for our long-term health? This episode is dedicated to demystifying high blood pressure, preeclampsia, and learning to nurture your numbers. Let's start with the basics. What exactly is blood pressure? The definition by the World Health Organization is hypertension, aka high blood pressure, is when the pressure in your blood vessels is too high. Now you're like, Brittany, what does that mean? Think of your heart as a pump and your arteries as the pipes, carrying blood throughout your body. Blood pressure is simply the force of your blood pushing against the walls of your arteries as your heart pumps. Also, according to the American Heart Association, a healthy blood pressure reading is typically less than 120/80 millimeters of mercury. When these numbers consistently creep up, that's when we start to talk about hypertension. We usually talk about the two numbers I just mentioned, the 120/80. So starting with the top number, systolic. This is the pressure when your heart beats and pushes blood out. Diastolic, that bottom number, the 80, this is the pressure when your heart rests between beats. Okay, I threw a lot at you. And you're like, why is this important to understand? Because high blood pressure is often called the silent killer. It usually has no symptoms, so you can have it for years without knowing. All the while, it's quietly damaging your arteries, increasing your risk for serious health problems like heart attacks, strokes, kidney disease, and even vision loss. So now you're probably asking, so who is at risk for high blood pressure? The truth is, many of us are. Full transparency, I got diagnosed with high blood pressure last year. So this subject means a lot to me. Some risk factors are things that we can't change, like our age or our family history. Many other things are within our control. I found some research on the National Institute of Health, Heart, Lung, and Blood Institute of some common risk factors. So we're going to start with your genetics, like I said. If your parents or close relatives have high blood pressure, there's a possibility that you might be prone to it. Your age. Our blood vessels tend to stiffen as we age, which can lead to higher blood pressure. Ethnicity. Certain ethnic groups, such as African Americans, have a higher prevalence and severity of hypertension. Statistics show that Black women in the United States have some of the highest rates of high blood pressure in the world, often developing it at a younger age with a greater severity compared to other racial and ethnic groups. Unhealthy diets. I love some fries and I love pizza. Pizza is my favorite food. But a high diet in high sodium and processed foods can significantly contribute to high blood pressure. Lack of physical activity. A sedentary lifestyle means your heart doesn't have to work as efficiently, leading to increased pressure. Obesity. Carrying extra weight puts additional strain on your heart and your blood vessels. Excessive alcohol consumption. Drinking too much alcohol can temporarily and over time permanently raise your blood pressure. Stress. This is something that I'm currently working through. While acute stress temporarily elevates blood pressure, chronic stress can also contribute to long-term issues. Smoking. Smoking damages blood vessels and can lead to increased blood pressure. And certain medical conditions like diabetes, kidney disease, and sleep apnea can also increase your risk. Now, when I first got diagnosed last year and I was doing all this research, it's very overwhelming and it can feel like you're drowning. But the important takeaway here is not to be discouraged. It's about awareness and understanding where we can make changes. Another vital area where blood pressure awareness is paramount is during and after pregnancy. Hypertension in pregnancy includes conditions like gestational hypertension and preeclampsia. They can significantly impact both the mother's and the baby's health. Let's start with gestational hypertension. This is when high blood pressure develops after 20 weeks of pregnancy in women who previously had normal blood pressure. Preeclampsia, this is a more serious condition characterized by high blood pressure during pregnancy. Preeclampsia can lead to serious complications such as preterm birth, seizures, eclampsia, stroke, and even death for both mother and baby. It's important to know that these conditions can develop even if you had normal blood pressure before pregnancy, and they can sometimes arise after delivery in the postpartum period, which can be particularly dangerous because the focus tends to shift to the baby in the postpartum period. While high blood pressure often has no symptoms in pregnancy and postpartum, please be aware of severe headaches that don't go away with pain relievers, vision changes, blurry vision, seeing spots, temporary blindness, swelling in the hands or face, sudden weight gain, pain in the upper right abdomen, nausea or vomiting, shortness of breath. If you experience any of these symptoms during pregnancy or in the weeks following delivery during your postpartum period, it's crucial to seek medical attention, whether it's your doctor, your midwife. Please don't dismiss them. Continue to follow up with your doctor as recommended, even if you feel fine. This is especially important for Black women who face a significantly higher risk of developing severe preeclampsia and experiencing maternal mortality from hypertension disorders of pregnancy. Advocacy, early detection, and consistent high-quality care are absolutely critical here. Now, this is where the nurturing aspect of our podcast really shines. We're not here just to identify problems. We're about empowering you with solutions and a compassionate approach to your well-being. So you're probably asking, how can we nurture our blood pressure and keep it in a healthy range? First, know your numbers. This is step one. Get your blood pressure checked regularly by a doctor. If you have concerns, consider investing in a home blood pressure monitor. I have one at my office. Learn how to use it correctly. Knowledge is power. Embrace a heart-healthy diet. Again, like I said earlier in the podcast, I love pizza. I love fries. I love it. It makes me feel so happy. But be mindful of processed foods, canned goods, and restaurant meals, which are often loaded with hidden sodium. Focus on fresh fruits, vegetables, lean protein, and whole grains. Get moving. I'm going to say aim for at least 150 minutes of moderate intensity aerobic exercise per week, or about 30 minutes most days. And you don't have to go to a group fitness class. It could be a brisk walk during your breaks at work, jogging, cycling, swimming, or dancing with your family or kids. Find something that you enjoy, and that's going to help you stick with it. Even a modest weight loss can make significant difference in lowering blood pressure. Focus on sustainable changes to your diet and activity level. Limit alcohol. If you drink alcohol, do so in moderation. If you smoke, quitting is one of the best single things you can do for your overall health, including your blood pressure. Managing stress, which I can speak for me personally, is not an easy thing to do, but finding healthy ways to cope with stress. This could be through meditation, yoga, deep breathing exercises, or spending time in nature, or just engaging in a hobby that you genuinely love. Prioritize sleep. Aim for 7 to 9 hours of quality sleep each night. Lack of sleep can contribute to higher blood pressure. I will acknowledge when I first got diagnosed, I started developing a sleep routine. Not having my phone next to me, bringing back my skincare routine, and not having the TV on, it actually did contribute to lowering my numbers. And medication, if you're prescribed it. If your doctor prescribes medication to manage your blood pressure, take it as directed. Don't stop taking it without consulting your doctor, even if you feel better. I want you to remember, small, consistent changes can lead to big results. It's not about perfection, but about progress. Be patient and kind to yourself on this journey. High Blood Pressure Education Month is a wonderful reminder to be proactive about our health. Schedule that checkup you've been putting off. Have an honest conversation with your doctor about any concerns you have. And remember, you are not alone. Reach out to friends, family, or support groups if you need encouragement or a sounding board. Share your goals. Celebrate your successes. Even if they're small, it's still a success. and lean on others when you face challenges. As we wrap up today's episode, I want to leave you with this thought. Taking care of your blood pressure is an act of self love. It's an investment in your future, ensuring you have the energy and vitality to live the life you desire. For more resources and information on high blood pressure, please visit reputable organizations like the American Heart Association and the Preeclampsia Foundation. Also, check out our blog post discussing high blood pressure being the silent killer, specifically in Black women. I've listed all the links down in the description below. Join me next week on Wednesday Wellness Debrief as we explore what inspired me to start my business focused on fitness and maternal health spaces. Until then, stay well, stay mindful, and keep nurturing your amazing self.